those of you who have just joined us, thank you for joining. If you don't already know me, I'm Dr. Emily White. I'm the Managing Director of Operations and FUS Partners here at the Focused Ultrasound Foundation. I also serve as the co-director of the Foundation's Center of Excellence program. Today, we are pleased to have members of the LabTAU research team present on how they have leveraged their Center of Excellence designation to expand their clinical collaborations and fulfill their strategic plan. I'd like to introduce our three panelists in advance. Presenting first will be Dr. Cyril Lafond. Dr. Lafond has a degree in physics and a PhD in biomedical engineering. He completed his postdoc with our friends at the Applied Physics Laboratory at the University of Washington. He has been a research scientist with INSERM for 20 years and was appointed the research director of LabTAU in 2016. In fact, he was appointed right before he accepted the Merkin Fellowship and spent a year with us at the Focused Ultrasound Foundation. Cyril today is going to provide a brief overview of LabTAU and their Center of Excellence strategic plan. Second presenting will be Dr. Angèle Chaud-Baudard. She is a dentist, she has a clinical practice, and she is also on the teaching faculty and teaches oral surgery and oncology in Lyon, in addition to her research efforts on using ultrasound for irradiated bone healing. She will do an overview of her Center of Excellence project. Last, we will hear from Apatou Engin. Apatou has a degree in instrumentation, a master's in image and signal processing, and a doctorate in biomedical engineering. He completed his postdoc with our friends up at Sunnybrook and has been a research scientist at LabTAU for a little over a decade now. He will speak on his COE project on neuromodulation. And now I will turn it over to Dr. Cyril Lafond. Cyril, the floor is yours.
Good afternoon or good morning, everyone. So my name is Cyril Lafond, and it's a pleasure for me to be the director of the LabTAU, and LabTAU stands for Laboratory for Therapeutic Applications of Ultrasound. So the LabTAU is based in Lyon, in southeast of France, close to the Alps, and this is a very important formation because next year I hope we'll have the opportunity to have your visit for the next International Symposium of Therapeutic Ultrasound, and this will be held in Lyon for Easter. So LabTAU counts around 70 people. We have a research scientists, doctors in different specialties, engineers, technicians, and also PhD students, because we are affiliated to the University of Lyon, but also INSERM, which is the National Institute for Health in France, and also Saint-Léon-Mérin, which is an hospital nearby, which is entirely focused on the treatment of cancer. The research at LabTAU has been entirely focused on the use of ultrasound for therapy, and for a very long time. It was founded in '85 by my colleague Dominique Catignol. And at that time, it was working on the use of shockwave for breaking stones. A bit later, under the direction of Jean-Yves Chaplon, we started working on the use of ultrasound for surgery, and this is where we designed a device with EDAP for treating prostate cancer. A bit later, working with high-tech care for the design of a treatment for glaucoma, as you can see here. And more recently, in 2010, we started working on drug delivery, and this is where we collaborated with the company Cartera for the opening of the blood-brain barrier. The scientific project of the lab is very clear. We want to design and transfer biomedical devices in the field of ultrasound and mechanics to meet a medical need. And as good example here, I'm showing images of two projects which were very important for the lab. The oldest one is what we've done with the company EDAP TMS, where we produce a system called Focal One for performing focal therapy in prostate for treatment of prostate cancer. And more recently, back in 2010, we initiated a collaboration with a company called Cartera, which designs some ultrasonic implants to open the blood-brain barrier, as you can see on this image here. You all know that ultrasound can induce different bioeffects, and I listed the three main ones in my opinion. Thermal ablation, what I call mechanical stimulation, and the last one is mechanical fractionation. It is known for a very long time that if you apply a few megapascal per second, you can reach very quickly a high temperature rise up to 50 degrees Celsius and get a coagulation necrosis. That's something which is very often used in clinics. At a lower pressure range and in pulse regime, very often in combination with a contrast agent, you can generate some mechanical stimulation for opening the blood-brain barrier or transfecting cells or modulating neural activity. And the last one, more recently used in clinics, is, well, except for lithotripsy, is what is called mechanical fractionation. So you apply very short bursts at low PRF, tens of megapascal, in order to generate shock waves and very intense mechanical constraints. And this is what you use for lithotripsy or esotropy. And in parallel of all this effect, you usually use some imaging modality for diagnosis and guidance. And I use this slide because this is how we structure the research in our lab, with different bioeffects and also imaging for monitoring treatment. So our job in our research is to modulate exposure conditions to control the bioeffects and respond to unmet medical need. So as I said before, this is how we organize the different research in our lab. You may know that we are evaluated every 5 years, so we have a current plan for 5 years, and this is the 4 axes that we define. The historical one is dedicated to high-intensity focused ultrasound. Then we have a lot of activity around neuromodulation, the LUS axis. We also use cavitation for therapy, that's the third axis, and the last one is imaging with a strong focus on elastography. We perform translational research in the lab. It's very important for us to gather a team of 3 for each project with 3 important stakeholders: clinicians, companies, and academic research, so LabTAU for most of the project. And in order to favor collaboration with company, we maintain a certification ISO 9001 since 2008. This is quite original for academic labs. So these are the different partners that we are working with currently. Historical one is EDAP TMS or Cartera I mentioned before, but we also collaborate with big groups like Vermont, Breas, or Cantel Medical, and small companies like Synaptech, Mindsound, or Nobactel. The research at LabTAU is very interdisciplinary. This is why we belong to 3 academic LabEx, or Laboratory of Excellence. One in Lyon is entirely focused on the use of acoustics and mechanics, so it gathers labs in this field from all over the city. And the second LabEx we belong to is the one which is focused on oncology. So this gives us the opportunity to collaborate with engineers, doctors, and also hire students from the different backgrounds. And finally, in 2017, we were designated Center of Excellence by the FUS Foundation, and we're the number 7. So that's the purpose of the current presentation. So our goal for this Center of Excellence is to promote the use of ultrasound for therapy. And we based our organization around 3 pillars: clinical, preclinical, and education. Very quickly, we set up a steering committee with different expertise. So obviously there were 2 scientists from LabTAU, myself and Stéphane Kathleen. We asked different doctors with different specialty to participate to the steering committee. So we had Gilles Dubernard from gynecology, Axon Carpentier, neurosurgery, Michel Rivoire, general surgery, and Olivier Rouvière, a radiologist. We also asked a colleague from the University of Lyon, which has some background in educational management, to be involved in this steering committee. We had some representative of the FUS Foundation, and we thought it was also interesting to have a representative of a company in order to give some input on the translation of the different projects we could work on. And this is Emmanuel Blanc, a former IDAP TMS, who joined this group. So this slide describes the role of the steering committee. So it meets twice a year, once in December and the other time in June. Every 6 months, we produce a call for a short scientific proposal with a maximum budget of 30 kilo euros. The steering committee produces this call, select the preclinical proposals for funding, and also evaluate and validate the progress reports of the different projects. The steering committee was also supposed to adjust yearly clinical objectives, but I must admit that with time we really focused on the preclinical proposal and leave clinical activity to the other scientists and ask them to go straight to the foundation if they needed some significant funding for running their clinical trials. The steering committee also discussed the education opportunities, evaluate and promote the educational content, and also check the budget of Center of Excellence. And of course, it delivers reports after each meeting. Regarding education actions, we started by observation of the context, where we noticed that HIFU is used by a very short number of pioneers or believers. And we had the chance to be affiliated to the University of Lyon, which is a pioneer university with remote teaching. It has developed for a very long time a web platform for education called Spiral, and we thought it could be useful in the context of our Center of Excellence. So the question was how to inform and educate a broader number of physicians through technology. So for that, we had the idea to first design a dedicated platform for remote teaching, a MOOC, on which we could find general courses on the physics, talks of experts, quiz, Q&A, with the purpose to create a community. And later on, we decided to organize a national event, a conference, we called iFuture, to promote therapeutic ultrasound. So let's have a look at the MOOC. So we disclosed 12 courses, which were recorded between September 2018 and March 2019. They are still available, and you have it's completely free, and you have the link here to register if you are interested. This is how it looks, and we had the chance to welcome great speakers, experts in their field, 6 doctors with different specialties and 6 scientists. So we had Florent Aptel, ophthalmologist, Jeff Elias, neurosurgeon, Alexandre Carpentier, neurosurgeon as well, Sébastien Crouzet, urologist, Pejman Gagnouni, radiologist, and Franco Orsi, oncologist. We had experts, scientific experts like Larry Cram, Gael Terra, Kurt Moonen, Bruno Kesson, Oleg Sapochnikov, and Shinichiro Umemura. So all of them came to Lyon and recorded a talk which provides a lot of very useful information if you are interested in the use of ultrasound for therapy. And if you follow the 12 courses and respond properly to the different quiz, then you'll get a chance to receive this diploma that certifies that you follow the MOOC properly. Let's say a few words on the iFuture 2021. So it was held in Lyon in June 2021. So you have images here of the event. Part of it was remote because of the COVID situation. So we had great technical presentations to give you an overview of the different effects we can get with ultrasound. We had reviews by young doctors for each of their field of what can be done with ultrasound in urology, cardiology, neurology, and others. We had the panel discussions and presentations from experts and early adopters like Pejman Gagnouni or Alexandre Carpentier. And we had also talks on the regulations and reimbursements in France. It was a really national event. We are supported by many companies who are very interested in the event. And if you are interested, you can still see replays which are available online in the YouTube channel of the lab. Also, we are working on a special issue in the journal that one of our scientists in the lab, David Melodolima, is the editor-in-chief. So it's a journal, it's called RBM, and our young doctors will provide a review for this journal. And just for your information, next year, as a satellite meeting of ISTU 2023, there will be a second edition of iFuture in Lyon. So the program will come soon, and I hope you'll be able to attend too. So let's talk about the preclinical mini project that we supported as well through this Center of Excellence. So just as a reminder, the expertise of the lab is to propose new devices and new applications for HIFU for therapy. And in the neighborhood of the lab, in the environment of the lab, there are many medical staff members which are not involved at all in therapeutic ultrasound. So the goal of this mini project was to ask them to propose an original project in order to develop new applications and see what can be done with ultrasound. So we had this internal call every 6 months, limited to, well, it was a very short proposal, only 3 pages, with a budget maximum of 30 kilo euros. And we received different applications, and you'll have some example right after my talk. And each project was driven by one of the PI of the lab in order to help regarding ultrasound questions. So just as a summary regarding this Center of Excellence of LabTAU, so over this period of time, well, since 2017, we had 8 meetings of the steering committee. We had more than 700 participants for the MOOC. This was number end of last year, so probably more right now. We had 150 participants for iFuture 2021, including clinicians, researchers, and companies. Regarding the mini project, we selected 14 of them, which represent 9 applications, new applications, 9 publications, but there are more coming now, 4 patents, and more interestingly, we use this money as a seed money. And after getting some initial results with this 30 kilo euros, we could get 4 major grants from ANR, or the National Institute for Cancer, and also 1 Eurosur project. So we really like the way we performed this mini project, and we thought it was very interesting to run the Center of Excellence as we did. Thank you very much for your attention, and I think we'll have a great talk now by Abutu Engine and Get Buddha.
Our team thanks the FAST Foundation for its support in developing an experimental model of irradiation in the rabbit mandible and the evaluation of a low-intensity pulse ultrasound-based new technique for the management of osteogenesis. First of all, let's remind that external irradiation is a major therapeutics in the treatment of head and neck squamous cell carcinomas. It generally consists in adjuvant therapy delivered in 20 to 35 sessions, with a total dose ranging from 55 to 70 grays. It aims to eradicate potential residual tumor cells. Nonetheless, it has some adverse events on soft tissues, but also on bone. Actually, it alters bone remodeling through impairment of vascularization, cell function, and collagenic metabolism. The ultimate alteration is osteogenesis, which leads to major surgery and alterations of the quality of life and even prognosis of the patient. Considering lipase effects in orthopedics or fracture healing, we propose the hypothesis that lipase could improve irradiated bone healing and thus prevent the occurrence of osteogenesis. We first needed to develop an animal model of irradiated mandible, and we chose the rabbit as it is easy to handle, cost-effective, and big enough to perform surgery on the mandible. Second step consisted in evaluating the effects of lipase on irradiated bone healing. 28 rabbits were included with 2 needle sockets per animal, one on the left mandible and one on the right mandible. The control group consisted in 10 rabbits, which only had surgery. 9 rabbits had irradiation plus surgery, and 9 rabbits had irradiation plus surgery plus lipase. The irradiation protocol was determined after a systematic review of the literature and aimed to mimic clinical external irradiation, which is fractionated in many sessions. Our radiation protocol consisted of 5 sessions delivering 8.5 grays each during 5 weeks. The irradiation was bilateral and performed on a linear accelerator, delivering photons. The CT scan was previously performed to calculate the dosimetry. The silicon sheet was placed to increase the thickness of the soft tissues and concentrate maximal dose on bone. Before the beginning of the irradiation, a radiograph was performed to validate the positioning of the animal, and a thermoform mattress was also used to increase the precision of the repositioning. At the end of the session, the animals were placed under infrared light and monitored until complete recovery. Follow-up was performed by daily examination, weighting, and water and food intake control. Standard limit points were fever, permanent decubitus, convulsions, severe anemia, pain symptoms resistant to analgesia procedures, and anorexia superior to 24 hours. Surgery was performed immediately after completion of the radiation treatment. It consisted of a standardized defect created thanks to a drill on each lateral part of the mandible. An incision by exorbital approach was made on the median line of the mandible, and the basal bone was exposed. A standardized bone defect was then created 5 mm measurably to the mental foramen on each side of the mandible. Lipase treatment consisted in 10 daily post-operative sessions of 20 minutes each for 2 weeks. This scheme was also determined after a systematic review on the literature. Experimental studies found were performed on dogs, thus the protocol was adapted for the rabbit. Rabbits were then sedated and sacrificed from D0 to D42 by 4 milliliters intravenous pentobarbital. Bone samples were then harvested. Micro-CT was performed according to standards for bone characterization in the rodent. The ratio bone volume on trabecular volume, trabecular number, and trabecular spacing were reported for each sample. The bone mineral density was also determined. Histological analyses were performed thanks to eosin hematoxylin coloration to assess bone healing and remineralization of the defect. A strong positive correlation was found between histological and radiological results. In irradiated rabbits compared with sham rabbits, we could observe less osteoclasts, a decrease of osteocyte cells in compact bone, large amounts of adipocytes in bone marrow, a rich collagen matrix in the alveolodental ligament. At D28, in the irradiated group, bone remodeling was very delayed, with only few osteoblasts and an achondral-like ossification. At D42, there was a mix of fibrous tissue and immature bone. The osteoclastic was increased compared with D28, and there were a lot of osteoblasts. Bone remodeling was active, but delayed compared with non-irradiated rabbits. Regarding micro-CT, there were statistical differences for BMD and BVDV between the control and the irradiated group, especially at D42. Thus, this model of irradiated rabbit mandible with a fractionated scheme seemed valuable. Regarding the lipase group, analyses are still in progress. Due to COVID pandemic, some results were delayed and are just under analysis. Cross observation showed that the lipase group seemed to have a better food intake, weight, and water intake. It was statistically significant at D42. Lipase might have an effect on post-radiation pain. and discomfort. Results for histology showed that there was a great heterogeneity in the lipase group at D42, from increased vessels and bone remodeling close to non-irradiated animals to a total lack of bone formation. It's yet not possible to reinterpret these data, and the number of samples doesn't allow statistically significant results. For micro-OCD, preliminary results seem to show that there's a small effect of lipase on trabecular spacing and trabecular number at D28. But at D42, it seems results are better for irradiated rabbits without lipase than for irradiated rabbits with lipase for all the parameters. Our hypothesis is that healing capacities of irradiated bone could be overwhelmed by lipase mechanical stimulation. By the time our work resulted in 3 publications, 2 international communication and 1 national communication. Another publication is in progress. Depending on the final results and if a positive role of lipase in irradiated bone is highlighted, this project could lead to clinical application. A case series from Professor Malcolm Harris, published in 1992, showed that combining lipase plus antibiotics plus surgical debridement allowed better results in extensive ulcerous necrosis and delayed mutilating surgery. It could be interesting to combine lipase with other therapies. The role of lipase on early vascularization could also be highlighted, as the effects seem better between D0 and D28. Thank you for your attention.
Hi everyone, my name is Aputo Njin and I'm a researcher at the LabTAU laboratory from the INSERM Institute and University of Lyon in France. I'm from the field of biomedical ultrasound physics and engineering, and the work I'm going to be presenting today has been initiated by a collaboration between LabTAU and the neuromachine interface team headed by Professor Alexander Carpentier from APHP and the Sorbonne University in Paris. The motivation of this team, and more generally of our activity on this topic, has been driven by the need to study electrical and ionic responses, especially their dynamics and the way they are modulated by focused ultrasound, to enhance our understanding of focused ultrasound neurostimulation phenomena. The main objective and the final objective of this work is to accelerate the transfer of this technology to patients. In this context, neurostimulation or neuromodulation by low-energy focused ultrasound is an existing and fast-growing field for the treatment of neurodegenerative, neurodevelopmental, or psychiatric disorder, such as epilepsy, Parkinson's disease, depression, among many others. Focused ultrasound offers the ability of non-invasively stimulating specific regions of the brain with high spatial selectivity. Early work in ultrasound neurostimulation or modulation includes applications on the central nervous system and the peripheral nervous system. This past decade showed a regain of interest in the technology, especially because of the improvements made in both fields, ultrasound biomedical domain and neuroscience. More recent studies performed on animal models reported on movement of limbs, whiskers, as well as eye movement and pupil dilation, when selectively stimulating certain motor regions of the animal's brain with ultrasound. Literature reports multiple investigations at different scales, going from single neural cells analysis to non-human primate behavioral studies. Some clinical studies have even been started recently to evaluate the effect of focused ultrasound on Alzheimer's disease or depression. However, so far it is not clear how responses occurring in the neural structures and responses that can be observed externally are associated and linked together. And for now, there is a lack of control in the focused ultrasound neurostimulation process, especially because the mechanisms are not yet well described. Despite the great number of studies highlighting the effect of ultrasound in stimulating or modulating neural activity, The exact cellular mechanisms of action involved in neurostimulation remain theoretical and subject of much debate. In my group, we were so far mostly interested in the understanding of neurostimulation. So we started a few years ago to conduct researches on various models of increasing complexity, with an eye to achieving useful information for the development of focused ultrasound neurostimulation. We have thus developed several research platforms for investigations ranging from in vivo giant axon models to full brain vertebrate model. The giant axon model, which is epitomized by the earthworm model in vivo. We first showed that focused ultrasound was able to trigger causally action potential very similarly to mechanical stimulation. According to the timing and the variability of timing of occurrence of those action potential, we are also able, by comparing those results between electrical and mechanical stimulation, to confirm that the locus of sensitivity to focused ultrasound was probably between the mechanosensor and the giant axons themselves, which means that the afferent nerves were the sensitive part. We also showed on this model that the neurostimulation success rate was clearly affected by the level of ultrasound intensity and radiation forces. As a contrary, we haven't shown any clear correspondence between the cavitation phenomenon, neither the stable nor the inertial cavitation phenomenon. Moving forward to another neural models, we decided to work on a very standard model used by electrophysiologists to better understand circuits. This model is the hippocampal brain slice, which is removed and analyzed ex vivo from a mice model. On this model, we were able to show that a single pulse focused ultrasound stimulation could trigger causally and immediately fiber volleys and local field potentials. Those neural activities can also be triggered by electrical stimulation. The MEA technology allowed us to monitor in 2 dimensions and in real time the spatial temporal distribution of those responses all over the brain slices. When repeating those focused ultrasound stimulations several times, we were able to access to the repeatability of the stimulation, and we confirmed that the timing of occurrence of those responses were very stable. However, the amplitude of the responses were pretty variable compared to electrical stimulation in blue. We also investigated the impact of the pressure magnitude on the amplitude of responses, and we showed that at 3 megapascal exposure, no responses were created in the brain. At 4.1 megapascal, we started to see responses with a certain variability. By increasing even more the pressure level, we increased significantly the magnitude of the neural responses. Another platform has been built to study the impact of a single focused ultrasound pulse on human cells that has been cultured in vitro on Petri dish. Cells were labeled with fluorescent dye, and fluorescence microscopy imaging was used to monitor neural responses caused by stimulation. In this platform, we were also careful to compare several types of stimulation. Focused ultrasound was compared to chemical, which is a standard, and mechanical stimulation, which was performed using a micropipette from a patch clamp system. Here is one example, very graphic, of what we can obtain when we adapt properly the size and 3D location of focal spot relative to the camera field of view. In this example, we use the 5 MHz ultrasound frequency to selectively trigger neural cells. As a result of the single pulse, a first cluster of cells immediately responded. Those responses were characteristics of calcium wave transmembrane fluxes. The propagation here exhibits a rather perfect circular symmetry at a certain speed, which could be analyzed and characterized to better understand the impact of ultrasound stimulation on neural cells. So those results were really promising for improving the precision and immediate effect of a single pulse focused ultrasound. To conclude, in our study, we found many analogies between models and means of stimulation. In our investigations, an elementary focused ultrasound stimulation was a single pulse of about 100th of microsecond. We investigated spatial temporal dynamics of focused ultrasound-induced transient responses and found very similar responses to mechanical stimulation. All those results are in favor of promoting the global focused ultrasound radiation force effect. In parallel, several groups are trying to identify the neural substructures sensitive to focused ultrasound. Finally, we still don't know if neurostimulation and neuromodulation are associated to similar biophysical mechanisms, and which of those would be more interested to be transferred in clinical applications. I would like to thank all the collaborations and fundings, especially people working with me at the LabTAU laboratory, Professor Alexander Carpentier from the Sorbonne University, and the team of Dr. Gilles Huberfeld from the Collège de France. I also would like to thank the French National Research Agency, who has funding us in the early years of this research, the LabEx Dev Weekend, and obviously the Focus Ultrasound Foundation. We were able to get 3 major national collaborative funding last year, associated to new collaboration with neuroscientists and access to new expertise and advanced models, such as on non-human primates. Here is the LabTAU group, and I will be happy to continue this discussion. Thank you for your attention.
So Cyril, Angel, and Apatou, thank you for your presentations. They were great. We're going to open it up for some Q&A to our live viewing audience. Please submit your questions using the Q&A function at the bottom of the screen. And while we wait for some questions to come in, I've got some questions on the presentation. So Cyril, since you're the boss, we're going to start with you. In your presentation, you commented that LabTAU is an ISO 9001 certified lab. And can you tell me why that's an unusual for a lab and what that certification is?
So basically, the former director, Jean-Yves Chaplon, initiated the process maybe 15 years ago or something like this, with the idea to facilitate the collaboration with company. That's kind of a nature of our labs. And the objective of certification is give us some different tools in order for example to track the documents, to increase the education of our students, to manage it with good manners or contracts, and all these sort of rules that we try to apply in order to perform a research of quality. So that's really the goal of this ISO 9001 certification, and we are evaluated every year to make sure we perform properly according to the certification.
So why do you think other labs don't do it? The burden of all of the paperwork, documentation.
Yeah, well, it may seem boring at the beginning. That's a lot of paperwork once you start, but after a while, once you know how to operate the system, I mean, it's a lot of time saving in order to find a document, file properly your reports. I mean, being able to find which equipment was used for each experiment. That's very interesting. If there is an issue with metrology, I mean, all this sort of rules are very interesting for us in the end. But I agree, at the beginning it may be frightening to put together, but once it's operational, it's a very good tool.
What about the difference between a lab that is just creating new knowledge versus a lab that's more geared towards translational medicine like you guys are. And I think there's an advantage, perhaps.
Yeah.
Have ISO 9, 2000.
Really, the original idea was really to comply with the strategy of our industrial partners. I mean, that was really IDAP, our historical partner, who really pushed for this certification. And in the end, we apply it for every contract we run with companies. So that's a good decision.
Okay. We've got another question for you. Question from the audience: where does the funding for LabTAU come from?
Well, it's very broad. Well, LabTAU is a public laboratory, so it's a lot of money from the government. First, our salary is paid by the government, and then we obviously respond to different call for proposals in order to get funding from different agencies, different foundations, like the FUS. But also we receive money from private companies in order to run some specific programs in collaboration. So that's where the money comes from.
Okay. In your presentation, you said that you received 5 major grants as follow-on funding to the Center of Excellence projects. So do you have any idea of what the value of those 5 grants? It can just be a rough estimate.
Yeah, well, I didn't make the addition, but and Aputu mentioned some of this funding for his particular project. I would say, and keep in mind that our salary is not supported. We don't have to support our salary. So just for operating the lab, we received something like 1.5 million. And in total, with all the partners involved in the different projects, I would say probably 5 or 6 millions of euros. So that was a
good return on investment
with 30 euros in the beginning.
Right. Very good. All right. I've got another question for you. So the steering committee funded 14 projects. I don't remember how many actually applied. We didn't fund everybody, but out of those 14, you've got 4 patents that are pending. So we won't talk specifics about the patents. We know we'll keep that quiet, but what's the average number of patents that LabTAU claims in a year, files in a year, or sort of equivalent time frame? Is that high, low, medium?
We file some, like between 2 or 3 patents per year. That's an average, but obviously I'd like to do more than that, but that's reasonable already. And I must say that it's harder and harder now to file patents in our field. I mean, there's a lot of competition. It's okay. Tough and interesting, yeah.
All right, Aputu, we've got a question from the audience, very specific, and it's specific to you. Can you rule out cavitation when you stimulate in vitro, or is it possible a mix of radiation force and cavitation?
So yeah, it's a really interesting question. It's actually a potential mix between those 2 phenomena, but our goal is to potentiate the phenomenon which is the easiest to be controlled. So we consider that the radiation force might be safer to control. And so in all our development right now, we try to optimize ultrasound parameter to push the radiation force effect rather than the cavitation effect.
Okay, Cyril, this one just came in, but we'll do it sort of jump order because it relates to the IP and the patents. On your patents, are LabTAU's IP patents focused on hardware or system aspects or non-hardware IP like methods, or is it really a mix of both?
It's really a mix. Yeah, it varies from one application to another.
Okay. On Gail, let's chat with you for a minute. Don't frown. So when Cyril and I were talking about which projects to present, we both felt very strongly that we wanted you to present your project. But Cyril told me that you were a little hesitant to want to present. Is that true?
Right, that's true.
So and this is sort of less of a question, but more of a comment to you. So I think osteonecrosis as a result of radiation is a real issue in the clinical setting. And not only is it causing major disfigurement, but it also, just creates functional issues of maceration for food, for digestion, all of those types of things. And so I think it was a great project, right? You really went out on a limb with your research team trying to figure out a rabbit model, and we had to do some adjusting with the model itself. And then the results, you had COVID in the middle of all of this, and then your results, you said, are sort of equivocal. You saw something that was sort of interesting at 28 days, but at 42 days when you sacrificed, you didn't. So just because the results are equivocal, I don't think that it's a frown project, right? I think the idea was great. I think the research that you did was great. Your logic was solid in looking at that dog model and looking at the literature, and the results are the results, right? And hopefully the results end up with lots of other questions of, other ways to try and explore to see if this is actually something that's going to work. So I think, publications have a real bias towards positive or good outcomes. But I think a null hypothesis project is just as good and just as valuable to communicate to the research community as a whole. And I'm glad that you're getting presentations and publications out of it. And I hope you'll continue this line of research, and I hope that we can find some more of it. So hopefully a null hypothesis sometimes generates a lot more research questions. And so Apatu, back to you, talking about research questions. On your conclusion slide, you had 10 more questions of what things that you wanted to go and try and figure out on your conclusions. And I think the intellectual curiosity of a researcher is really well demonstrated by your conclusion slide. We always love to hear your presentations, and we're glad that you have, I think we funded at least 2, maybe 3. I can't remember if that's 2. Your third project that we did, or that was your second project that we just approved.
Second, yeah.
Okay. So as a LabTAU research scientist, can you comment a little bit on what the Center of Excellence process was like? And negative feedback is more than welcome, but talk to me a little bit about the application process, the timeliness of results, what it felt like to have to present progress reports in person or via video. Was that a good experience? Was it anxiety ridden? What did you think about, right? Because this is a new format that we're trying with Cyril here in the Center of Excellence.
Okay, yeah, it's a good question. Actually, I tried to mention in my conclusion all the really good outcomes that we get thanks to the FUS Foundation funding. So the whole process to me was perfectly adapted to what we were needing for a new research team. Neurostimulation was not in our lab an historical research team, so it's something that we initiated a few years ago, efficiently. And so the Focused Ultrasound Foundation funding was very well sized, and I think appropriate in the method of application for such type of new projects. Especially because I think one of the main objectives of the foundation is to promote the collaboration between researcher and clinician. So, the fact that we start to think about the clinical application from the beginning, that we create a couple between a researcher and a medical doctor from the beginning, I think is a really positive point. And that helped a lot to me to target to focus our research on something which can be easily, which can be transferred as soon as possible. So in my conclusion, indeed, I had many additional questions because I think those questions are really important for the transfer of the technique. And especially in neurostimulation, I can see two type of research: people who are trying to use the technology and see what we can bring very rapidly into clinics. And our method was a little bit different. We came back to very simple models, and we really appreciated that the Focused Ultrasound Foundation was okay with this, because we came back with much harder, stronger knowledge. And I think this is a good way to accelerate also this research. So we're happy that the foundation was not afraid that we were coming back in a bit more fundamental research, even though it's very relative, because thanks to this fundamental research on simple models, we were able to come back on an in vivo application much faster and with a certain confidence.
Yep. And you were one of the, and I'll just give a plug to you so you don't have to mention it, but you were one of the projects who got some really nice additional funding, follow-on funding afterwards. So good. Okay, so and Gail, how about?
I mean, just a follow-up on Apu2 answer. I think I really would like to take the opportunity to thank the different doctors which were part of the steering committee. They were very engaged, very positive in the critics of the different presentation, and very helpful in the design of experiments. So let's thank for them.
Yeah, I agree. So, Gail, what was from a clinician? This original RFP went out to the clinicians. What was your experience like with this sort of new model?
Yeah, thank you. That's really great, because before working with Cyril and his team, ultrasound was just a synonym of scaling for me. And I learned that it's not only scaling. So it's really interesting. And even if our results are not what we expected them to be, I still have some ideas. I just moved from Lyon to Nantes this year, so I'm trying to begin new projects, and maybe I'll come back to you, Cyril, because I also found some. So I work on another irradiation model. It's on the rat. It's already done in my new lab, and we could work on the effects of lipase on radio-induced hyposalivation. So it's another field to explore, and working with scientists like Cyril and Apu2 maybe it can make us feel like we're not really, we don't really have the right place in research, but it's a little bit like that, because everything is so new and maybe brilliant for us, but it's really a very, very good experience. And well, I think, as Apu2 said, it's the only way to improve patients' health and care. So,
okay. What do you think? And this could open to the group. Question came in: how do you train clinicians that are new to the technology to deliver focused ultrasound treatments both safely and effectively? Right, because now we've got this clinician component to what we're doing.
So that wasn't really the purpose of our activity in the Center of Excellence. We really focused on preclinical activity in this first 3 years, but in the future maybe we will shift a bit further with all this preclinical work we've done toward clinics. For the moment, the clinical activity is more organized with the companies we are working with. So this is these companies we are really training the different doctors we have in the lab.
Right. So from a technical standpoint in developing the technology, you're training the doctors that are working with the companies. Mm-hmm. And then really it's the companies that are doing the ongoing clinician training.
So the only thing we did right now is really the MOOC in order to give some initiation on the field, but not really training the clinicians on a particular device for particular applications. So this is more the role of the company who's building the device. I think we should do that. Mm.
So since you brought up the MOOC, let's talk about the MOOC for just a second. So you've got 700 people who've gone through the MOOC since we developed it. So I think that's a success. So what are your thoughts about expanding the MOOC, or what do you want to do next?
Well, if the Center of Excellence is renewed, probably we'll discuss that. There will be probably some other topics we could include. Neuromodulation is one of them. I know we missed some course on the treatment of fibroids, which is the main application of iFuture in the world. So I'm sure we can find other topics which could be presented by international experts and added on the MOOC. So that's something. I mean, every propositions are welcome.
So logistically, how did the MOOC work for creating the modules? You had 6 clinicians and 6 sort of bench researchers.
Mm-hmm.
And how did that work? What did you guys do?
So, we'll just give general instructions to the speakers. They have a broad topic. The idea is not really for them to present their work, but more like doing some kind of review of their field. Okay. They prepare their slide. We can format their slides so they can appear properly on the image once they come in Lyon for being recorded in the studio. And then we have somebody working on the formatting of the videos, and we can just have it online after that. I mean, we work with them on the quiz, also on the way to interact with the people if needed, and it runs quite easy. I mean, the addition of Olivier Nier of the steering committee was really interesting for us, because he's one of the creators of this Spiral platform, the University of Lyon. So he's very helpful, and he had many ideas in order for us to create this new education tool.
And I think that's a good point, that it was a sort of a specialty and an expertise that was at the University of Lyon, and it wasn't necessarily your lab, but because of that collaboration that you were able to do this. And I'm hoping that all of those folks who came to record on the green screen maybe poked around in the lab and did some meetings with your researchers or presented on whatever research they're currently working on.
Mm-hmm. Usually each time the scientists were coming to Lyon for being a code, is also give a more specific talk in the lab for our staff. So it was very interesting for us.
And they all hopefully came willingly, giving your we had the winter. I think maybe you recorded a few more in the winter than in the summer. All right, last question. We're going to wind down real quick. But this one is for Cyril. Is metrology of the lab's equipment an important aspect to collaborate with companies? And do you have any advice for other labs?
I missed the first word, which is, I think, very important. Is what? Metrology?
Metrology. Yep.
Yeah, metrology is something we are very focused on. It's part of this quality insurance system. There is specific process on that. We have some very periodic check of the device, and each time there is something wrong detected, there are alerts, and this is where it's important for us to list on our lab book which device was used for which experiment, and then we can inform our partners if there's something wrong, etc. So metrology is actually very important for us. Yeah, I agree. So I'm not sure if I responded to the question, but that's something we are very focused on. Yeah.
Well, that will have to be the last word. We are out of time. So this concludes today's webinar. I think we had one question that we didn't answer, so we'll try and get an answer from Apatu and email it out to that individual. But if you'd like more information, you can visit our website at fussfoundation.org or email us at info@fussfoundation.org. Thank you for joining us today, and please stay tuned to our newsletter and website for invitations to future webinars and online events. And very last word is, I want to make sure that the symposium, the Focused Ultrasound Foundation Symposium, is on everybody's calendar, October 23rd through the 28th, and we hope to see you all there. Thanks, everybody. Thanks to Gail. Thanks to Apatu. Thanks to Cyril. And have a great rest of your day.
Bye-bye. Thank you very much.
Bye-bye.